Hi, I am Deborah Ruiz and I will speak about cardiac metastasis in melanoma. About the definition, cardiac metastasis is a late manifestation of disease and can cause arrhythmia, myocardial dysfunction, pericardial effusion, heart failure, or right ventricular obstruction. In the application in medicine, metastases that cause symptoms but cannot be removed may be treated with radiation, immunotherapy, target therapy, or chemotherapy. The treatment of widespread melanomas has changed in recent years as newer forms of immunotherapy and target drugs have been shown to be more effective than chemotherapy. About pros and cons, as a pro, we have that immunotherapy is a biological therapy that uses the body's natural defense to fight cancer. Substances made by the body or made in a laboratory are used to enlist or restore the immune system that works by destroying cancer cells and thereby stopping the cancer from growing. About the cons, among the cons, we find the side effects of immunotherapy, although immunotherapy is relatively specific because it tends to recognize the abnormal cells of the tumor and not help them. This treatment is not harmless. Sometimes there is a local reaction in the injection area, a febrile illness similar to a flu-like process, but on the other occasions very rare due to the massive release of immunosubstance. A clinical picture that resembles shock can occur, septic with circulatory collapse and organ failure, mainly lungs and kidney, which end up being awful organs and potentially fatal. About the issue applied in Ecuador, the risk of developing melanoma is associated with ultraviolet radiation, skin color, and geographic location. In our country, because its location is in the Ecuador, ultraviolet radiation is high and it increased even more in high altitude areas. The incidence rates of skin cancer are higher in Ecuadorian highlands such Quito, Cuenca, and Loja, and compared to Guayaquil, Manabí, and El Oro. Among Quito residents, it presents 1.7% of all of cancer diagnoses in the 2011 until 2015 period. 75% occur in people over 47 years of age. Incidence rates increase in men and in women from 2.7 and 2.90x 100,000 in the 5-year period. 1986 until 1990 to 4.4 and 3.6 in the 2011 until 2015 period. Quito ranked 40 in men and 41 in women among 69 countries in Sci 5-6. As conclusion, we have when symptomatic cardiac melanoma metastases typically present with shortness of breath and tachycardia with a predilection of the left ventricle and right atrium. Surgical intervention and immunotherapy is currently the mainstay of treatment for the successful management of cardiac melanoma metastases. Thank you.